Good afternoon, everyone. We hope you're having a good day. We are going to start the presentation shortly. We just want to wait for a few more attendees to sign in. So we will be starting right around 12 o'clock. I wish we were seeing some of the sunshine that we see in these clouds. Hopefully that might be coming a little bit later today. But there is good news on the horizon. There is additional funding coming, as I'm sure you've probably been keeping up with. So I do think that sun will be shining someday down the road. And fortunately, we do have relief opportunities that we're going to be speaking about today that can hopefully tide things over for you. Okay, in just another moment, and we'll start the presentation. Attendees are still continuing to come in, so in just another moment we'll start. Okay, well, good afternoon, everyone. I'm Susan Reed from Sachs LLP, and I welcome you to the webinar. We have a great team assembled today to provide you with updates of relief opportunities available to healthcare providers. Before I introduce the panelists, I would like to let you know that this webinar is being recorded and that we will be providing you with the slides. Keep in mind that information is changing hourly, so if you are listening to a recording of this, please be sure to contact your advisor to ensure the information is up to date. And I also want to take a moment to thank our marketing team for putting this together, and a special shout out to Margaret Henn for accommodating the many updates we've had to the presentation. Now, to review our agenda, we're going to speak about one of the updates we've all been anticipating, additional funding. We're also going to provide a brief overview of key Paycheck Protection Program and Economic Injury Disaster Loan Program considerations, as well as other employer stimulus programs. Then on to the all-important requirements for the PPP Program Loan Forgiveness. And lastly, we're going to do a deep dive on the CARES Act Healthcare Provider Relief Fund and give a few pointers on the Advanced Payment Program as well. Now let me introduce our panelists. From the Sachs Healthcare team, we have Debbie Nappy and Todd Christensen. And as our special guest speaker today, we're excited to be joined by Grace Mack, who's co-chair of the Health Law Group at Wilentz, Goldman, and Spitzer. Now on to some much anticipated news. Both the Senate and House have now approved $370 billion in funding for small businesses. $310 billion will go toward the PPP program funding. So those of you that might have gotten closed out of the first round of funding, there is still hope. $60 billion is going to be going toward the EIDL program, with $10 billion of this funding going to replenish the $10,000 EIDL grant program. Certainly more is to come on this. The president, we're hoping, is going to sign today, and SACS will be holding weekly webinars to keep you updated on these changes. So now a few general takeaways from the PPP and EIDL program. Applicants can take both PPP loans and the EIDL loan. There is also a new Main Street lending program that expands the loan options that are available, as well as other deferrals, credits, and incentives we'll be speaking about. To give you just a quick overview again of the economic injury disaster loans, which also is getting just a general round of funding, the maximum loan balance, which is given at the SBA discretion, is $2 million. The $10,000 grant that we spoke about earlier is part of this EIDL program. However, there are net worth and taxable income limitations. There's a fairly robust application you have to submit with the SBA, and unfortunately, there is no forgiveness aspect other than the potential $10,000 grant. However, the loans have great terms. There's a 30-year amortization, with nonprofits qualifying for a rate of 2.75% and for-profit businesses 3.75%. So great if you are really in need of that additional funding. And now I'm going to turn it over to my partner, Todd, who's going to walk us through an overview of the PP program.
Thank you, Sue. Good afternoon, everybody. Thank you for attending today. It's only been 4 weeks since the CARES Act was signed into law, which included the Paycheck Protection Program, or PPP. The program calls for loan forgiveness, or a free money aspect, which Debbie will speak about later. These loans or grants require no personal guarantees, and the ability for the company to repay the loan is not considered in the application process. We've recommended to all of our clients that if they're eligible, they should apply for the maximum loan. The program is administered by the Small Business Administration, and it requires applicants to apply through SBA-approved banks. I'm hoping there are many people attending today who have already received their PPP funding, and others who have worked with their bankers to complete their applications and are now awaiting the additional funding that's coming soon. If anyone attending today believes they may qualify for a PPP loan but have not yet applied, they should contact their banker immediately to start the process. Some banks have really done a great job working with their clients to secure these funds, but some banks have not. Please let us know if you would like an introduction to an SBA-approved lender. You can email our task force at covid19@sacsllp.com. Again, that's covid19@sacsllp.com. One recent clarification that I wanted to highlight, as shown on the next slide, is that self-employed individuals are eligible to apply for the PPP, even if they do not have any other employees. So in effect, the self-employed individual is the employee. A couple other stimulus programs I'd like to discuss with you briefly. The first is the deferral of the employer FICA or Social Security tax. This was part of the CARES Act, and under the original guidance, it said if you're going for a PPP loan, you cannot also do this deferral of the Social Security tax. Since then, there has been further guidance, and the rule now is you can defer your payroll taxes currently until you receive forgiveness under the PPP program. So if you got your PPP money, you're in your 8-week forgiveness period. At the end of that period, there's going to be a calculation of your forgiveness amount. At that point, once there has been forgiveness of a portion or all of the loan, then you can no longer defer these payroll taxes. So if you're not going for the PPP, you can still go defer your payroll taxes through December 31st, 2020. A couple other things regarding the deferral. Half of it will be due at the end of 2021, and half will be due at the end of 2022. And deferring this tax has no effect on the loan forgiveness calculation under the PPP program, since this payroll tax is not eligible for the forgiveness under the PPP. The next item, which is already up on the screen there, is the paid sick and family leave credits. This was part of the FFCRA, the Families First Coronavirus Response Act. Now, that was the first act, the first stimulus bill that went through in the middle of March. Under this law, the employees receive paid leave for specified reasons related to COVID-19. Either the employee is quarantined, they're caring for a family member, or they're caring for a child whose school or place of care is closed. And so the employee gets paid, they get their paid leave, and the employer receives a dollar-for-dollar tax credit for the entire amount of the wages paid. And what's really nice about this is they get the money immediately. It's an immediate reduction of the payroll tax remittance. So right after you run your payroll, the payroll company calculates what's going to be sent into the government. They take that off right at this time. So it's immediate cash savings. And the calculation will actually run through the 941 quarterly payroll tax return, not the income tax return. And one other thing to mention here is that there's no double dipping. If you get the credit under this family leave bill, then it's not, the wages are not eligible for PPP forgiveness. Now I'm going to pass the baton to Debbie Nappy, and she's going to talk about the PPP Loan Forgiveness.
Good afternoon, and we want to welcome you to our webinar today. Up until this point, many of us, our clients as well as ourselves as advisors, we've really spent countless hours helping our clients be able to apply for the PPP loan. We've worked with payroll companies and we've gathered the information, and many of our clients right now have received their funding, or they know that their funding is about to come through, as well as, like Todd had mentioned, there are unfortunately some clients, given some banks, where they are still awaiting, they're in the queue, now they're relieved that at least these additional dollars have come through. But now the next phase is, how do we prepare so that we can make certain that the majority of the funds that we have received are going to be now considered a grant and not a loan that we have to repay. Now, one thing that throughout my presentation that I'm going to have to refer to is we should be receiving the regulation should be coming out on Monday. They were promised 30 days from the signing of the bill. So from everything I'm reading, all the other webinars I'm attending, Monday is the date that we should be in additional guidance to answer some of the questions that we have not yet been able to answer. So I'm going to go through once again, what is the calculation? What should we be planning for? How do we now put our thoughts together and come up with this 8-week plan as to how we're going to spend the funds that we have received from this PPP program? So in all that we know that payroll costs have to account for 75% of our expended dollars, and no more than 25% have to come from non-payroll covered costs. But let me go through what payroll costs include. So we know it's wages, salaries, commissions. Wages are capped at the $100,000. Someone even broke it down that in the 8-week period, that $100,000 equates to $15,385. In addition, we have payment of vacation pay, parental, family, medical, or sick leave, not to then, as Todd alluded, we cannot then also get the new provision under the Family First Coronavirus Response Act. We have retirement benefits, 401k, our profit sharing match, deferred compensation plans, and then as well as then we have our group health insurance premiums, and then payment and local taxes assessed on employees' content. Now, some of the questions that we're receiving are, can we prepay bonuses? Can we give bonuses? If bonuses were part of your calculation of your monthly payroll, we would assume that was part of your business, how you operate, how you compensate, that would continue. Prepaying a bonus just to qualify for these dollars, at this time, we do not believe that that in fact does qualify. But like I said, on Monday, we should then be given further clarification. Now, of the 25% or less of covered costs that we can pay during the 8-week period, they are as follows. Payments on interest of a mortgage obligation that was incurred before February 15th of 2020. Questions we've received on this are, can I pay for other interest on other debt? And the answer is, you can, but we do not believe that that is then going to qualify for forgiveness. So that portion of it could then become a loan. Then we have rent payments on leases that were entered into prior to February 15th of 2020. A lot of questions on this is, can they be equipment leases? We're hearing varying opinions. Some say, oh, as long as that lease was in place, you have the lease document, it qualifies. Others are saying, no, it will not. It has to be a facility lease. But then again, on Monday, we should have some of these questions answered. Then we have utility payments. Utility payments under your service agreements, once again, with a date prior to February 15, 2020. What is considered for utilities? In the law, it's written electricity, gas, water, transportation, telephone, or internet access. The gray area is transportation. What is included in this transportation cost? Some definitions or clarification that we received is it's fuel costs. Once again, Monday, hopefully that will then further clarify for us what is included in that gray area. So now, in addition to just the dollars we're expending, 75% payroll, 25% other covered costs, we then have to reach other metrics regarding the headcount of our employees. So we know that if our headcount drops with our full-time equivalents, we then might not have all of our loan forgiven. However, let's go through this and see what measurement date we're looking at and how to then utilize this to the best outcome. So first we start with, we have our average number of full-time equivalent employees during the 8-week period beginning when the loan dollars are dispersed. So if you receive your loan today, it's considered funded and the loan period begins today. You have 10 days from the date that your loan officer notifies you to then draw down and receive those dollars and sign your documents. So in looking at this, the SBA gives us 2 periods that we can look at. We are able to utilize the frame that produces the least amount of full-time equivalents. So as stated on our screen, February 15th, 19 to June 30th, or January 1st, 2020 to February 29th. So whichever time period reflects or produces the least amount of FTEs, that is what you want to utilize as now your base to then compare to this 8-week period. And then it's a formula to see where we're at in this calculation. In addition to your FTEs, Then you also have to look and see, have the salaries been decreased? So during this 8-week period, like I said, beginning with the origination of the loan, we then need to look and see the dollars, the payroll dollars. Now, it does state that if the decrease is not in excess of 25% during this period, that you would still be in compliance. And we also know that salaries in excess of $100,000 are capped. So if you have an officer who is making $150,000 and now you scaled him back to $125,000 during this time because of cash flow, that's not going to impact this calculation because he was already capped at the $100,000 limit. Now, in addition, because of the difficulty of the circumstances that we're in, because if you're not an essential business, you cannot bring back your employees, any reduction in your employee base, as well as the dollars during the period of February 15th of 2020 to April 26th will not be considered in the calculation. So in all that we're reading, as long as you restore your employee FTE number by June 30th of 2020 and restore the reduced salaries or wages, you will still qualify for the forgiveness. And that is where planning is taking place. That is where we are speaking to our clients and saying, you know what, as our state, our local tri-state area, we cannot open at this time, but you know what, we can now pay for vacation pay. If there's a severance package for someone who was irregardless of COVID or not, you can pay out those severance dollars. So there's a lot of planning that needs to take place in the next few weeks to make certain that you're capturing these dollars the best you can, which will then enable you to have loan forgiveness. Now, what are the documentations that are going to be required? Just like when you applied for this loan, you had documents that were required by the bank. You had to provide payroll reports, other information that was pertinent. You had to certify that the information was correct and true. After the 8-week period, you're now going to have to apply once again for the forgiveness aspect. So here are some of the information that we're gathering that you are going to have to provide. Now, I've reached out to several payroll companies in the last few days just to find out, are they going to help provide the calculation, for instance, of the number of FTEs during this 8-week period in their payroll reports? You're going to have all of your payroll documentation, your payroll tax filings, your canceled checks, right, for the rent, as well as utility bills. You're going to have to gather all of your documentation as support for what you paid during this 8-week period. In addition, like I said, you're going to have to certify. Whoever's responsible is going to certify that, in fact, this information is true and correct. And then the lender is then going to have their 60 days from the receipt of the documentation to then render a decision as to whether or not you qualified and submitted all of the documentation necessary to then be given forgiveness. Now, here are some other questions that are still pending, still unclear. First one being, is this going to be on a cash basis or an accrual basis as far as determining the expended costs? From what I heard, there's some confusion, or where this confusion begins is the way that the law was written, that it speaks to incurred and expended. We're of the mindset that it's going to be cash basis based on dollars spent and expended during this 8-week period of time. Question number 2 is, what if you spend less than the 75% of these loan proceeds? Well, then we go back to then the entire amount would be considered a grant. It would not be fully forgiven. That portion would then become a loan subject to 1% payable over 2 years with a 6-month deferral. However, there are provisions that, well, you know what, no, let's scratch that. I was thinking about the reduction of the 25%. So that portion would then not become a forgiven aspect of it. Number 3, should full year bonuses and year-end profit sharing contributions be included? We're waiting for guidance on that. We do not believe that you can include the full amount. Just like when we made the calculation, it was the average monthly cost. We believe that you would then be within that same calculation as average cost as opposed to the full amount. Rent covered only for facilities or equipment rentals. We are still waiting for clarification on that. Full-time equivalents. I heard some interesting conversations that we determine full-time equivalents based upon 30 hours and other calculations. We're now going to wait to see how does the SBA define a full-time equivalent. Number 6, what if we had non-COVID reductions? Will their salary or severance, I'm assuming, be considered for loan forgiveness? Yes, because if things are not working out between you and your employee, and irregardless of the circumstances we're in, they're going to be separated for employment, and you're providing a severance package to them, that is still a covered cost during this period. And then I'm just going to go to number 8. Do the headcount allow for replacement of the terminated worker? It's a head count, so you do not, if you furloughed or laid your employee off during this period, and now you're going to be bringing them back, if they choose not to come back, you can replace them with another individual. So it does not have to be the same person, it's just the head count. And then here are the questions where, in general, we're all waiting for additional guidance as well. We discussed transportation costs. What is it exactly? What does fuel costs entail? Is it auto? Is it trucks on the road? We need some further clarification for that. As well as back to the June 30th date, qualifying for the rehire FTE count, as well as then bringing back up your wages and salaries. Number 11, will these expenses give rise to a tax deduction? From what we're hearing, since the money that's going to then be determined forgiven is not income, the respective expenses will also then not be a deduction. However, with that being said, we are not certain yet, state by state, how they will then deem these funds. And to that point, we hear from some clients, some banks are recommending they open a separate account to then go through and be able to track the expenses that are being expended. That's personal. If you feel that you have enough, your accounting measures in place can track these expenses, we can help you with that. So please use our email. Please ask us any questions, that are coming to mind. There's a lot that's taking place here. It's a short period of time to go through and plan, and we are more than willing to provide some assistance in this. Thank you. So with that, I have the privilege of introducing our guest speaker today. She is the co-leader of the healthcare practice of Willentz Goldman, and I'd like to introduce you to Grace Mack.
Hi, good afternoon, everyone. My pleasure to be here, and I want to thank the Sachs firm for inviting me to participate. It's interesting times we're in, and I really want to thank them for all the work that they put into getting this webinar together. So I'm going to talk about the Provider Relief Fund. As part of the CARES Act, which, as you know, was signed into law in March of 2020, there was a provision for $100 billion in relief funds to help hospitals and other healthcare providers. The purpose of this $100 billion, as was stated in the law, was to support healthcare-related expenses or lost revenue that was attributable to COVID, and to ensure that uninsured Americans can get the testing and treatment for COVID-19. So those were the two overlying purposes of this program. So whenever I hear $100 billion, which is the amount that's part of this program, I can't help but think of Austin Powers and $100 billion. So keep that in mind as we go through the presentation. So the first part of the program was this infusion of $30 billion. So as some of you know, the providers, that beginning on April 10th, 2020, the Department of Health and Human Services began this infusion of $30 billion of the $100 billion. And they started it by directly depositing it into certain eligible providers' accounts. So keep in mind that these payments, they aren't loans, they are that need to be repaid. It's almost like a grant. According to HHS, this program is not a loan, does not have to be repaid. And this is different from the accelerated Medicare payments that some providers may have received under the CMS program. Those are advances that have to be repaid or credited against future payments. This program under the Provider Relief Fund does not have to be repaid if you follow all the terms and conditions. So who is eligible? Who is eligible for this $30 billion amount that was allocated? So the major requirement is that the first $30 billion is facilities and providers that provided Medicare fee-for-services in 2019 are eligible. That's the first requirement, and it's subject to the terms and conditions, which we'll go through. So first, you have to have received Medicare in 2019. So then once you're eligible, how is the money distributed? So the way HHS is doing it is that providers are distributed a portion of the initial $30 million based on their share of the total Medicare reimbursements in 2019. So the total reimbursements in 2019 were $484 billion. So if you want to estimate what your portion would be, you can divide the total 2019 amount and that you received by the $484 billion, and then multiply that by 30 million. I know you need an accountant for that. So you can obtain your 2019 billings from your revenue management system. So what's an example? Assume a community hospital billed $121 million. So if they wanted to determine how much they would receive, they would just do the calculation. Divide the $120 million, divide by the $484 billion, times it by the 30 billion, and you come up for this community hospital. If they billed $121 million, they would get $7,500,000. That comes out to 6.2%. So if you want to figure it out, you can figure out where your amount lies. And this was based on Medicare billings, and it really doesn't collections. It doesn't have to do with whether the provider was impacted by COVID when they came up with the amount. So some of the statistics that I've seen is this has really not been necessarily favoring those states or providers who have been treating COVID-19. For example, New Jersey has been treating, I think it's 11% of the COVID population, but only would receive 3% of the money under this formula. So who gets the payments? How is it divided up? So the way it was done is by the tax identification number of the billing organization. So large organizations and health systems, they would receive the payment for each of their billing TINs that bill Medicare. So each organization has to look and see how many different TINs they use, and that's where the money will be deposited. Employed physicians, they're not going to receive the money directly. It's going to go to their employer organization, the TIN number that billed for it. And then physicians in a group practice, individual physicians and the providers in the group practice is not likely to receive it individually. It will go to their group practice. Again, they look at the TIN to see who received the Medicare payments, and that's what it's going to follow. Solo practitioners, So the practitioners who billed Medicare will receive the payment under the TIN that they used to bill Medicare. And then what is the method of payment? How will it be paid? Well, HHS partnered with United Healthcare Group to provide the payments. So providers are paid by automatic clearinghouse on file with United Health if they have that already on file. And if they do, it would have appeared in the bank account as HHS payment, as the payment description. Providers who receive a paper check for their reimbursement from CMS will receive a paper check for this payment, according to HHS, to be paid within the next few weeks. So is this free money? Are there strings attached? Well, of course there are. There are terms and conditions. We have a link here to the terms and conditions. I don't think you can click right on it, but my understanding is Sachs will be sending the PowerPoint with the links probably within the next 24 hours. So it's important, if you're accepting this money, to look at those terms and conditions. So what are in those terms of conditions? What are the certifications? So the first one is you're certifying that you billed Medicare in 2019. The second certification is that you provide or provided after January 31st, 2020, diagnosis, testing, or care for individuals with possible or actual cases of COVID. That provision caused a lot of confusion and misunderstanding at the beginning. Was this only going to providers who treated COVID patients? But HHS did clarify that it's broader than that, that if you ceased operations because of COVID, or if you treated possible or actual cases of COVID, you would still be eligible. They specifically said that they are broadly viewing every patient as a possible case of COVID-19. This provided some clarity, not total clarity, but at least it gave us some bit of guidance on that. Another certification is that the provider does not have its Medicare billing privileges revoked and is not terminated or excluded from participation. And one of the other conditions is that this recipient certifies that payment will only be used to prevent, prepare, or respond to coronavirus, and shall reimburse the recipient only for healthcare expenses or lost revenue that are attributed to coronavirus. This goes back again to some of the guidance where they said that it broadly views it as every patient being a possible case of COVID-19. So we are still waiting for guidance, but it does appear to apply. And another important term and condition, I call it the no double dipping provision. The recipient has to certify that it will not use the payment to reimburse expenses or losses that have been reimbursed from other sources. So you really have to keep track of any other funds you may have received, for example, under the Payment Protection Program. So you can't get the money twice. So that's another important record keeping that has to be done. Another condition to keep in mind is that you have to, providers must agree that they won't seek out-of-pocket payments for any COVID presumptive or actual case, and that they can't seek reimbursement or try to balance bill for amounts that are greater than the patient would have received or been required to pay if the provider had been in network. So this is the no balance billing provision, which was an important part of the program. But that has also created confusion, because certainly providers who are treating patients and getting this program might not necessarily be, might have been out of network and might be treating patients and expecting their out-of-network payments as they usually would be expected to. So there was some additional clarity on this point where HHS clarified that this involved, you can't seek out-of-pocket for presumptive or actual cases. Used to say possible. So this has been interpreted as meaning that the patient that you're not seeking collection from has to be a COVID patient or a patient who's being treated as a presumptive COVID patient, not just any patient. So that provided some clarity. Again, we have to wait and see if there's any more clarity on that. And then another important condition of the provider program is that the recipient has to submit reports that the secretary determines. We don't know. We have some reports, which I'll go into, but there could be additional reports and additional future program instructions. And what are some of the documentation and reporting requirements that are in the terms and conditions right now? Well, recipients have to maintain costs and record documentation in accordance with various CFR requirements. And also, the recipient has to submit copies of reports and cost documentation upon the request of the secretary of Health and Human Services. So even if you do the reports that are in this terms and conditions, you still are subject to having additional requests. And what are these specific requirements? So there is a requirement with specific reporting as to any recipient that is an entity receiving more than $150,000 in total funds under the CARES Act, or also the Corona Preparedness Response Appropriations Act and the Family First Act. So to the extent that the provider receives $150,000 or more under any or all of these programs, they have to submit additional reports. And there are specific items that have to be in this report that are contained in the terms and conditions. The first one is the total funds received. So number one, total funds received. There also has to be the amount of funds that were expended or obligated for each program. There has to be a detailed list of the projects or activities for which large funds were expended. There has to be a name and description of the project or activity. There has to be an estimated number of jobs created or retained by the project. And there has to be detailed information on the contracts or sub-grants awarded by the covered recipient. And then one thing that really has to be kept in mind is that the HHS portal makes it clear that Health and Human Services intends to audit providers. So documentation is essential. HHS guidance even says there will be significant anti-fraud auditing and work done by HHS, including the work of the Office of Inspector General. So it's really important that documentation be there to support any of the funds. So what are some of the methods to keep track of this? Well, everyone really has to work with their own finance department and their accountant to come up with how they're going to keep track of all these expenses and funds. I did find some guidance in this Provider Relief Loss Calculator, which was prepared by the American Academy of Family Physicians. There are links to that, which will be provided, and it's a start. It's a worksheet, and it has items, possible items for expenses, and also possible items of how to compare your revenue. So it's something to start. Obviously, it's just a template, and you can work with your accountants, such as the Sachs firm, to customize it based on your particular circumstance. And then there's some other provisions in the terms and conditions, some statutory provisions that you have to keep in mind. Even though they're in the fine print, they might be relevant to what you're doing. So the first one is executive pay. It says none of the funds can be used to pay the salary of an individual at a rate in excess of executive level 2, which currently is $197,300. So that's something to keep in mind. And it can't be used for guns to promote gun control. It can't be used for lobbying. Can't be used for abortions with some limited exceptions. It can't be used for embryo research, legalization of controlled substances, pornography, needle exchange. There are some exceptions to the needle exchange, if it's something that would cause a significant risk, say in the HIV population, you'd have to check to see if one of those exceptions applied to your practice. It can't be used for propaganda. It can't be used if you have unpaid federal tax liabilities, if you have a criminal felony limitation. Can't be used for human trafficking. So these are just some of the general government-wide provisions in the terms and conditions. One of the other provisions I'm sure you all have to keep in mind is that none of the funds can be used on any project that entails the capture or procurement of chimpanzees obtained from the wild. So that is another one of the provisions you get in the terms and conditions. So again, the fine print is important. And then, what happens? What happens if you don't want to agree with the terms and conditions? If you do want to, traffic in chimpanzees. So if you don't agree with any of those terms and conditions and you receive the money, you must contact HHC within 30 days of receipt of the payment and then remit the full payment to HHS as instructed. So that's something where you might want to wait till, if you want to do that, to wait closer to the 30 days. So maybe we have more guidance on some of the terms and conditions. So that was the first 30 billion. So what about round two? What about the other 70 billion? So initially, the government had given their priorities for the remaining 70 billion. They said that in the future, there will be targeted distribution that will focus on certain providers in areas impacted by COVID-19, rural providers, and providers of services with lower shares of Medicare reimbursement who predominantly serve the Medicaid population. And that's a question that I get a lot, certainly, like, for example, pediatricians. They wouldn't have received Medicare in 2019, but certainly they're just as affected. And then another factor that was going to be looked at in the future was reimbursement for the treatment of uninsured Americans. So when we started this webinar, in between a couple days ago, in between when we were ready for it, of course, there was another change and another update. So on April 22nd, HHS announced additional allocations of this provider relief fund. So we're not going to go into as much detail on these because they just came out, but we're going to go do a quick overview. So HHS will begin this distribution, or has actually begun it, of another 20 billion of the general distribution, which will be a total of 50 billion of the 100 billion. That's a general distribution, not a targeted distribution. And this 20 billion is to be based on the provider share of 2018 net patient revenue. So this is different than the earlier 30 billion, which was based on the 2019 Medicare revenue. This is based on 2018 net patient revenue, and it doesn't seem to specify payer specific. So according to HHS, on April 24th, a portion of providers will automatically be sent an advance payment based off the revenue data that they submitted in a CMS cost report. And providers without adequate report costs on file with CMS will need to submit their revenue information to a portal that is theoretically opening this week. So there is a link to that for these additional general distribution funds. And then providers who automatically receive the money, if you're one of those providers that it automatically went because there was a cost report on file, the information still needs to be verified. And according to HHS, payments will go out weekly on a rolling basis as information is validated, with the first wave to be delivered at the end of this week. Similar to the earlier money, providers who receive these funds will also have to sign an attestation confirming receipt of the funds and agree to the terms and conditions and confirm the CMS cost report. I believe there are going to be additional terms and conditions applicable to this 30 billion general distribution relating to the 2018 revenue. I looked at the terms and conditions. There were a couple changes. Again, the terms and conditions seem to be getting updated. So have something to keep an eye on. And then in addition to those general distributions, HHS also announced that a portion of this money will be used for certain targeted allocations. So the first targeted allocation that they indicated was a targeted allocation for high impact areas. So $10 billion is to be allocated for hospitals in areas that have been particularly impacted by COVID-19. So hospitals serving COVID patients in New York and presumably New Jersey, which have a high percentage of total COVID cases, should receive a larger share of these funds. HHS directed hospitals to apply for a portion of the funds by providing required information via an authentication portal. It said before midnight, Thursday, 23rd. That's April 23rd. So this portal is live, and hospitals should have already been contacted directly to provide this information if they're one of these targeted allocation providers. The next targeted allocation is an allocation for treatment of the uninsured. So any healthcare provider who provided treatment for an uninsured COVID-19 patient on or after February 4, 2020 can request claims for reimbursement through the program and will be reimbursed at Medicare rates subject to available funding. We need more information about that process, but according to the release, steps will involve enrolling as a provider participant, checking patient eligibility and benefits, and submitting patient information, and then receiving the payment via direct deposit. Providers can register for the program on April 27, 2020, and begin submitting claims in early May of 2020. For more information, you can visit the HRSA website via the link we provided. The next allocation is for rural healthcare providers. $10 billion is allocated for rural health clinics and hospitals. There's an allocation for Indian Health Service, so $400 million will be allocated for Indian health facilities, distributed on the basis of operating expenses. Then what about future allocations, the rest of the $100 billion? Well, what the guidance we have so far is that HHS states that there are some providers who will receive further separate funding. So the categories that HHS listed, we have to really keep an eye on, but they said skilled nursing facilities, dentists, and providers that solely take Medicaid. So we have to stay tuned and see what, the rest of this money and what are the conditions on that. And there's a lot of HHS resources that certainly we referred to, and there's links throughout the presentation, but I also have a list of some of the basic HHS websites that lead you in really to the other ones, but that's a good place to start. And also HHS announced that they contracted with United to set up a hotline. I do have that number there. Theoretically you could call it and get questions. I haven't tried it, but certainly it's there. So that's what we know so far about the Provider Relief Fund. We certainly have to stay tuned and see what's going to happen with the rest of the money.
Great. Thank you so much for being able to jump on this topic when round 2 came out. I believe it was on Tuesday. I felt bad that we had to update the presentation for that, but thank you so much for getting us all this really valuable information. As we look at the interplay, you did mention that the participants can get both funds from the PPP program and from the Provider Relief Program. Just so that we're clear, because we went through a lot of information, can you distinguish the ways the substantiation for those plans might be a little bit different?
Sure. Well, the main thing about the PPP program is that it's reimbursed. It's reimbursing for very specific costs. The payroll costs, the utilities, the rent, the mortgage, the things that Debbie went through. Where the Provider Relief Fund is really broader and includes lost revenue, which is certainly a big factor that's not covered by the PPP. And it also includes expenses you might have, for example, maybe related to implementing telemedicine. So there are various costs and expenses that may be covered by the Provider Relief Fund that wouldn't be covered by the PPP. But again, make sure that there's no double dipping.
Terrific. And I do want to make sure that we also quickly touch on the advanced payment program that Medicare has implemented. It's a program that's already been in place. But Debbie, could you give us a few highlights of that program?
Sure. Under the CARES Act, it was also another provision that was made available. However, this is purely a loan. It is an advance. It's based on a formula. And for practices, they have 3 months to make the repayments, whereby a hospital has 6 months. And then after that period, the interest rate is in excess of 10%. So just keep in mind, it is available, it is a formula, but it can be costly if your practice is not up and running to the full potential of it was prior to COVID. and it then could end up being a costly way to finance your operations at this time.
Terrific. And we know that some of you have probably submitted questions for us. We are going to address those questions. We don't have time now, but if you can submit any questions you have, either via the chat or, as you'll see on the screen, or COVID-19 at sacsllp.com. If you did have any questions for Grace as well, you could submit them to this address, and we'd be glad to forward those on to her. We do want you to keep in mind, we do have a couple additional webinars coming up. On Wednesday next week, we're going to talk through wealth management strategies, staying the course through COVID-19. Certainly hard to do as all those volatility that's in the market. And then, as I mentioned, on Thursday and continuing on Thursdays at 10 a.m., we're going to have more information preparing for forgiveness, updates on loan options, and forgiveness strategies. We are also available to assist if anybody needs help in trying to track expenses, keep spreadsheets together. We know there's a tremendous amount of information we disseminated, but we're here to help if you have any questions. We're sorry, we understand there might be some technical difficulties with the presentation, so we appreciate you sticking with us through that, and we look forward to answering your questions. We hope everybody stays safe and has a great day. Thanks so much.